Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the opportunity to sit down with Elizabeth Landsberg, who serves as the director for the Department of Healthcare Access and Information, which oversees the Office of Healthcare Affordability. In today's episode, we learn how the state of California has leaders and departments in place which are really condensing the often outpaced growth of healthcare. And this new Office of Healthcare Affordability, its goals using data and visuals to really influence policy and keep healthcare affordable for Californians. In today's episode, we learn of Elizabeth's journey from growing up in Washington, D.C., whose parents were involved in government, to her journey out west, where she studied in California and has really planted roots in leading this new office and ultimately making healthcare more affordable for all of us who reside in California. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us on our YouTube channel, our website, pophealthpodcast.com, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Good morning, Elizabeth. Thanks so much for joining the show today.
Good morning. Glad to be here. Thank you.
You're welcome. Thank you. All right. So before we get into kind of the work you're doing here in California, we like to get to know our guests a little bit, Elizabeth. So can you share something with us, maybe outside of the workplace, maybe fun fact, hobby, something like that?
Sure. So recently, my husband and I became empty nesters, which you can't imagine when the kids are little, but we have a senior in college at CU Boulder, and then a freshman who just left. So we're having to brush our hobbies off again. So I love being outside. We're doing more hiking and running outside, doing some gardening, and I do play a little bit of guitar just for fun. So trying to spend a little more time on those hobbies.
That's great. Now, you mentioned guitar is for fun. Do you ever perform periodically, or is it truly just kind of on your own for fun?
It's pretty much on my own. Yeah.
Okay. You mentioned one of your children is a senior at University of Colorado Boulder. Is that correct?
Yeah, CU Boulder, and then my other's at Cal Poly San Luis Obispo. So they're interestingly both engineering majors. One is an aerospace engineering major, and one is a manufacturing engineering major. And I know little about engineering, but we've decided it's a combination of my kind of analytical advocacy skills, and then my husband's an artist and an art teacher. So.
Oh, wow.
Interesting to see that come out.
Yeah, I was gonna ask if your husband had an engineering background, but obviously he doesn't. But those sound like great careers. Now, for University of Colorado Boulder, is that where the big football story happened this year?
Yes. And my eldest has zero interest in football, but it's like, oh, that's why it's crowded on Saturdays on campus now.
That's funny stuff. Well, thank you for sharing that, and congratulations. Sounds like your kids are well on their way to hopefully having great engineering careers. Great to know about them, but let's get to know you a little bit more. Tell us where you grew up and ultimately how you got into government or public service.
Yeah, so I think the two are actually related. I actually grew up in Washington, D.C., and when you ask people where they're from and they say Washington, many people are from suburbs, but I actually grew up in Washington, D.C. on Capitol Hill. Near Union Station. And my parents met working for the federal government. So they met working for the Civil Rights Division of the Department of Justice. They worked on voting rights cases and desegregation cases in Alabama and Mississippi in the 60s. I think they had their first date in Alabama. And so I think I did have a great introduction to government being able to make a difference, seeing just kind of, because my dad worked for the Civil Rights Division for most of my childhood. He stayed there, and so was always surrounded, kind of hearing about the impact of their cases. Washington, D.C. was a really fun place to grow up. You would just assume that that there world-class free museums that you can walk into anytime, and the best fireworks, and all those things that you kind of take for granted. Did go to a couple of the presidential inaugural parades, which was fun. So it was a really great place to grow up and see the impact the government could make. It was also an interesting place to grow up because it was, I think it was about 80% African American when I was growing up. So very much of a African American city, and with gentrification, that's changed. We had the white flight, and then apparently white people decided it was cool to live in DC again. So it's changed a lot. But I went to public school, elementary school, and was one of a couple of white kids in my classes. So kind of had the experience of being the other, but then also had the privilege, obviously had my white skin privilege and was able to go off to private high school. So it was an interesting place to grow up, a wonderful place to grow up.
Well, thank you for the background. So what happened after high school? Where did you end up going to school, and ultimately how to get to California?
Yeah, so I did go to undergrad in Southern California, and then worked for a few years. I was not one of those folks who went straight to grad school. I did go to law school. So I lived in San Francisco in the 90s and then went to UC Berkeley Law School. Right before law school, I had worked at a shelter for battered women and their children, and wanted to, so during law school, I mostly worked on civil rights and women's rights issues, worked at the Lawyers Committee for Civil Rights, and worked at Equal Rights Advocates was my first job out of law school. So it was a little bit of chance that I ended up in healthcare. I ended up moving to Sacramento. We were looking to move to Sacramento, and there was a job to be the supervising attorney at the Health Rights Hotline. And the job description said 5 years of healthcare experience preferred. And I had no healthcare experience, but I had a lot of public interest experience. So, it always depends on who the candidate pool is,
Yes.
and got the opportunity because I had that strong public interest experience, got that first job in healthcare in the year 2000. So I've been doing health policy work for more than 23 years. And I think, as with many of us, once you get interested in healthcare and get exposed to it, it's such an impactful place, such an impactful policy area, and impacts everyone. So have been in healthcare ever since and really love doing that work.
That's great, Elizabeth. Thank you for sharing that background. So it sounds like, your upbringing, there's been this consistent desire to serve the community from multi-generations in your family, which is pretty cool. I apologize, folks, and Elizabeth, I have an Alexa device as we're recording today. And for the first time, maybe in 200 episodes or so, you may have heard, I think she picked up on something and thought we said Alexa. So I do apologize. We'll try to edit that out. But if it doesn't, we'll call it just a fun part of the episode today. So you mentioned you came out, went to school at Berkeley. So what drew you to California after growing up in DC?
Oh, yeah. So my dad actually grew up in Sacramento. So he grew up in Sacramento and got the job with the United States Department of Justice in the Civil Rights Division. So moved out there. And so we met my mom there, grew up, and then he eventually moved back to Sacramento and taught at McGeorge Law School. So I have an interesting relationship to Sacramento because I didn't grow up here, but I do have family history here. So my grandmother was born here. My dad was born here. I actually live close to various places that he lived when he was a kid, and lived near where he went to kindergarten. So I have some fun stories. So Sacramento is such a great place to raise kids and buy a home. And we've been very lucky to be near the grandparents. So gravitated back to Sacramento.
That is fantastic. I know what you mean about the grandparents being close by. Hopefully that meant you had some date nights or something like that every once in a while.
Yeah, we had some great help. Yeah.
That is fantastic. So how did you end up in your role today, Elizabeth?
So as I mentioned, my first job in healthcare was working at this health rights hotline at Legal Services of Northern California at LISNIC. And in the 90s, when there was so much managed care, I think some of the big foundations realized how difficult it was for consumers to navigate, how not everyone understands that they have to go to their primary care provider for referrals, how authorizations work, how the billing works. So they set up this program called the Health Rights Hotline, and I got to work there for 5 years. And I'm so glad I started my health career working directly with consumers. So folks, we did have some uninsured folks. And at the time, before the Affordable Care Act, there were some uninsured people who there were no coverage options for them. But people with billing problems, people who couldn't get the care they need, people who couldn't find a specialist. So we assisted them, and I was supervising the hotline counselors, but also took a phone shift every week. And definitely some of those health consumers stay with me. After working directly with consumers for those 5 years, I had the opportunity to work at the Western Center on Law and Poverty. And they are a wonderful nonprofit serving the needs of low-income Californians and advocating around healthcare, public benefits, and housing. So I was a registered lobbyist representing the needs of low-income, poor Californians. So did a lot of work on Medi-Cal. I was there for more than a decade. Was the director of our advocacy program there, and got to work on the implementation of the Affordable Care Act in California, and helped work on and write the Medi-Cal expansion bills, which was just an amazing experience to get to do that. So I worked in the legislature, but I also did a lot of administrative advocacy. So did a lot of work with, because of working with the Medi-Cal program, with the Department of Healthcare Services, with the Department of Managed Healthcare, with Covered California. I was at every Covered California board meeting as an advocate even before it was called Covered California. So weighed in a lot with state agencies, and eventually thought, I'm kind of the external advocate, urging state government what to do. I should try coming on the inside and doing it myself. So my first state job was with the Department of Managed Healthcare, which regulates health plans, and I oversaw their help center as a deputy director. So consumers who get care denied from their health plan can file for an appeal. So we helped consumers with complaints as well as providers who might not have been getting paid timely. So that was a great experience. Did that for 4+ years, and then had this opportunity to be the director of what was, when I was appointed 3 years ago, we were OSHPD, the Office of Statewide Health Planning and Development, and I came on, and OSHPD had a great portfolio of programs we were working on, but there was this proposal to add this new Office of Healthcare Affordability because of the rising healthcare costs, and I know we'll talk more about that. So we went through this recast. We graduated, as our portfolio was growing, we got to graduate from an office to a department and come up with this great name of HCI, Department of Healthcare Access and Information.
That is great. So great background. So tell us, and this is where I'm a little bit confused, so forgive me. So we have HCAI, the Department of Healthcare Access and Information, but then we also have the Office of Healthcare Affordability. So is the office under HCAI?
Yes. So HCI is the department. So HCI is the Department of Healthcare Access and Information. We have 5 different program areas that we work on, and affordability is one key area. But I'd love to talk a little bit about HCI's other areas before we dive into the Office of Healthcare Affordability.
Please do.
Yeah. So HCI, again, has 5 main areas. On the facility side, we are the building department for hospitals and skilled nursing facilities. So we set the building standards for hospitals, including the seismic safety standards. And we've been doing that for 50 years. On the financing side, we provide loan insurance and facilitate access to funding for nonprofit health facilities under our Cal Mortgage program. But most recently, our finance team stood up the distressed hospital loan program after Madera closed its doors almost at the end of December of 2022, and the legislature allocated funds for distressed hospitals. Our finance team stood that up. On the workforce side, we know that California doesn't have the workforce that it needs. We have a lot of workforce programs that we have for decades, helping train doctors, nurses, but now we're expanding to community health workers, a lot on the behavioral health care side. So working to diversify California's health workforce, and also make sure we have primary care and behavioral health providers in rural areas in particular. So we focus on medically underserved areas. Our 4th area is data. So we have, again, for decades, managed and analyzed different data sets, including patient data sets, hospital financial data, skilled nursing facility, the same. We recently launched California's all-payer claims database, the HPD, the Healthcare Payments Data Program. And so we have a lot of great visualization. So if you're a data geek, if you're a health data geek like I am, we really hope you'll go to our website and check out our many data sets. And then the Office of Healthcare Affordability, or OCA, that affordability office got added in the budget in July of 2022. So I know we'll be focusing on the Office of Healthcare Affordability this year. We think there are some really great synergies with the data sets and also with the workforce programs. The other two things I'll just mention briefly under our affordability portfolio is that if you've heard the governor talk about the fact that the state of California is manufacturing biosimilar insulin products and generic insulin to try to disrupt the very broken insulin market and offer insulin at a transparent, affordable price. HCI is actually overseeing that work. So the CalRx program is under us. And then last but not least, we're standing up a hospital fair billing program. So January of 2024, folks can now file for a complaint if they feel they've been wrongly billed by their hospital. So lots of work. So the Office of Healthcare Affordability is within our HCI department and all that other work that we are doing.
Wow, that is great. That is quite a bit that your group does. So quite quick question on the hospital complaint opportunity starting next year. Is that for any type of hospital? Is it not-for-profit hospitals, all the above?
Yeah, all hospitals. So in 2006, California passed a Hospital Fair Pricing Act that puts limits on what hospitals can charge uninsured and underinsured patients. So back in the day, uninsured patients were the only people who were being charged the sticker price.
Yeah.
You and I have insurance. Our insurance company negotiates what we're charged at a hospital. Uninsured folks were getting charged the sticker price. So this caps what underinsured or uninsured folks could be charged at the Medicare or Medi-Cal rate.
Okay.
And then also put some limits on when can you be sent to collections. So every hospital has to have a charity care policy and a discount policy and has to abide by those policies. And we have a team that will be making sure that the hospitals do that.
That is fantastic. I have a personal experience with some interesting billing. So it's nice to see that there's movement there. So that'll be January 1st.
Too many people have had that experience. So we need to, and it's overwhelming for a consumer who gets a high bill and just thinks that's okay and that they should start paying it. And we're certainly hearing a lot about that at the Office of Healthcare Affordability.
That's great. So folks, we're recording this right before the flip from 2023 to 2024. So Elizabeth, do you happen to know, I know it's going, is it ready to go live? Like, is there a website when folks hear this episode or see this episode, and can you share what that website would be, how folks can get there?
Absolutely. Our website is hcai.ca.gov. So hcai.ca.gov. And we are highlighting both our Office of Healthcare Affordability and our hospital fair billing program. So listeners, please go to our website if you think you got a hospital bill that was higher than you should have, and file a complaint online with us or by mail if you need to. We're here to help.
That's great. Yeah. So one of my questions that I was thinking of asking you today was the reception to your newer Office of Healthcare Affordability. And before answering, I do want to acknowledge there's kind of two groups, I would think. There's the public who receives the services, but then there's also the hospital leadership who need to be reimbursed fairly. So I'm guessing receptivity, since the majority of the population are folks like me, we're probably excited about it, but maybe there's folks who aren't so excited. I'm curious, like in general, what's the receptivity to the Office of Healthcare Affordability?
So the Office of Healthcare Affordability deals with healthcare costs and affordability very broadly, right? So it's beyond hospital costs, but also pharmaceutical costs and all costs. So, I think it's really interesting to look at the history of OCA and how it came to be. So it actually is the product of a little bit of a strange bedfellows coalition. So, there are previous, I think, first and foremost is, why do we need to address affordability? We rarely need to convince people about that, because most folks have seen their premiums go up year after year, their deductibles and their copays go up so extensively. So we overall healthcare spending in California has just been increasing at such a rapid clip. It was up nearly 30% between 2015 and 2020, reaching more than $10,000 per person and $400 billion in the state. So we've really seen. So I graduated from college in 1991. At that time, per capita healthcare spending in California was $2,700 a person. And then 30 years later, in 2020, it was more than $10,000, $10,300 in 2020. So we've seen healthcare costs go up almost 5% a year on average. And it's really doubled inflation and family wages. So anyway, just to give a little bit of background, why healthcare affordability is a huge problem. It's been eating up people's wage increases. We have a lot of labor unions that are supportive of the office, because when they go to the negotiating table, when premiums are skyrocketing, are increasing at such a high rate, it's very difficult to negotiate higher wages for folks. So we have really broad consensus that affordability is a problem. There was a bill that would have allowed for the government to actually set healthcare rates. People didn't like that, didn't want to have caps on rates. So then a coalition came together and said, well, we have to do something about affordability. If we're not going to set healthcare rates, what can we do?
So the Office of Healthcare Affordability doesn't make the laws, but you collect data, and then are the lawmakers coming to you to hear what's happening and then creating the laws, or how does what your group does influence what happens, I guess?
So there's three main components of the Office of Healthcare Affordability. So one of them absolutely is around data and transparency. So I'll just go through each of those. So we have some data. So the data that I just cited is kind of our best guesses. There is some data about healthcare costs, but it's not as comprehensive as it needs to be. Okay. So the one key component of the Office of Healthcare Affordability is going to be to collect what we're calling total healthcare expenditure data and have comprehensive total healthcare expenditure data for the first time. And so, yes, we do think that'll be an important data point for policymakers. Related to that data transparency and collecting that data will be that we have a new healthcare affordability board, and they will be setting a spending growth target in California for the first time. So that spending growth target is a rate of growth beyond which healthcare costs shouldn't increase. So we have a preliminary staff proposal of a 3% spending growth target. It's up to the board to adopt that. Most states who have adopted spending growth targets have set them somewhere, in the 3% to low threes. Oregon, I think, is 3.4, going down to 3%. So transparency, data, and a spending growth target is one piece, key piece. The second key component to the office is that we know that healthcare consolidations are a major cause of cost increases. Right. And the data that always sticks with me, so Gavin, we have Healthcare Affordability Board meetings monthly. They're public meetings. Anyone who's listening can go on our website and participate in those meetings, either virtually or in person. This summer, we had a presentation from some economists about consolidation and its impacts. And this is the data point that stuck with me, is that when two hospitals merge, the research shows that prices go up 20 to 44%, so a big increase in prices. Quality stays the same or goes down. So, often with mergers and acquisitions, there's claims that we're going to, improve quality, we're going to bring costs down, and that just hasn't been the experience. It increases those entities' bargaining power. And it hasn't led to increased costs. So all of that to say that as this is airing in January of 2024, we have new authority that any merger or acquisition of healthcare entities in California, there are lots of different thresholds, but it's a 25 million or more. They have to file a notice with our office. So we'll have new transparency. If there's a proposed transaction that we have a concern will impact negatively on affordability or patient access, we can do a full cost and market impact review, and we can refer cases of concern to the Attorney General. So, so new authority over consolidation. So we have the data and the cost targets, we have the consolidation oversight. And then the third important main prong of the Office of Healthcare Affordability is around performance improvement. This is not about, we don't want to race to the bottom to just bring healthcare costs down. We think, and research shows that there are ways to actually improve care and bring costs down. So on the performance measurement side, we are going to the board will be setting benchmarks for spending on primary care and behavioral health. The research is very clear that when in healthcare systems that invest more in preventive care and primary care, you do get that magic combination of lower costs and improved health outcomes for consumers, and that's what we want to see. We also want to change the way healthcare is paid for. Anytime you have a fee-for-service system where a provider gets paid for every service that they do instead of for the outcome, there's an incentive to do more services. So we're working on alternative payment models to have more of a value-based approach to payment. We'll also be measuring some equity and quality measures alongside costs. So this is really about trying to improve healthcare at the same time we control costs.
That is, you guys have a lot going on. The office, my recollection, and folks, I had the opportunity to hear Elizabeth speak at the California Association of Health Plans annual conference, and that's where we met briefly afterwards. This was back in October of 2023. So my understanding is the office officially opened in January of 2022. Do I have that right?
July of 2022. Yeah.
Sorry about that. July of 2022. So it's been almost a year and a half. You've talked about kind of what you all are working on. Have there been any additional like changes or wins or challenges that you haven't mentioned in the last year and a half?
Yeah. So again, we were created in the budget. So we officially went live July of 2022, but of course it takes time to bring on the staff. So we've been hiring staff and have made significant progress in each of the three main strategies I described. So we've been working toward data decisions on measuring that total healthcare expenditures and gathering information to guide the board's work to set the targets on healthcare spending growth. So again, that spending growth target establishes a maximum limit on acceptable rate of spending growth for healthcare entities. That first step is data and transparency. So over the last year plus, we've been figuring out how to do that data collection on total healthcare expenditures. And we have put out proposed regulations about how to collect that data. And again, we have proposed the first spending growth target. So that's a very important milestone that we've just reached. The Healthcare Affordability Board just started meeting in March of 2023. So we had to hire our staff. The board is appointed by the governor, the Senate pro tem, and the Assembly Speaker. So we have a wonderful, engaged, very, very knowledgeable healthcare affordability board that will be setting those spending growth targets. So the board started meeting in March of 2023. We meet mostly monthly. People who are regulated entities under the office can't serve on the board. So, a hospital executive, a health plan, someone who works for a health plan can't be on the board. So in order to make sure we're hearing all of those voices, we also have an advisory committee. So the board appointed an advisory committee, and that advisory committee started meeting in the summer of 2023. So we have a 27-member advisory committee that includes consumer advocates, members of unions, purchasers who are buying the health coverage, health plans, hospitals, doctors, and frontline healthcare workers. So we've hired our staff, we've set up our board, we've set up our advisory committee, and we really have made significant progress toward all of our streams. Our cost of market impact review regulations and process are going live in January of 2024.
Okay.
And then on the performance measure side, we have started to define primary care so that we can set those primary care benchmarks in the summer of 2024. And also we have started to work on those alternative payment models to move more toward value-based purchasing. So really, I'm very proud of the team's work in all of our work streams. Just want to make a note that both our Healthcare Affordability Board and our advisory committee meetings are public meetings. So people can, again, come in person or watch. We post our minutes. Stakeholder engagement is very important in this process. And I think, there's some uncertainty. Change is hard. And we know that something has to change with our healthcare system to make it more affordable and accessible for consumers. And we need to really work alongside our stakeholders every step of the way.
Awesome. Well, we appreciate that. And can you just say your website one more time for us?
Yeah, our website is hcai.ca.gov. So that's hcai.ca.gov. And again, there's a affordability link. You can go to the affordability link. There's information about our board, our regulations, our advisory committee. We also have some technical work groups weighing in. So we're having a lot of engagement with consumer advocates, with industry representatives, a lot of coordination with our sibling departments also.
That's great. So you've talked a lot about what you've done so far, what's happening. I usually like to end each episode with things that the guests are looking forward to in 2024. You kind of touched on a lot of things that will be happening next year. Is there anything else that you're looking forward to here in the new year?
Yeah, I mean, I really am excited about each of the three main work streams that we're working on, because I think it's important to have all three to work in concert to drive toward the high value system that Californians need and deserve. So a key step is the greater transparency. So the office will be publishing an annual report on the spending growth targets and on health spending trends. We'll also be including kind of some best practices and some models for how, so some recommendations to slow cost growth and improve the quality and equity. So excited for that first annual report. In 2024, the Healthcare Affordability Board is going to set that first cost growth target. So by June at the latest, but they may do it as early as March or April. We're proposing a 5-year target. We think it's important to have for the market to know what's coming. In subsequent years, so that first target is a statewide target, and in subsequent years, the board has the authority to set different targets for different sectors. So they could decide this geographic area spending's gotten particularly out of whack. We're going to have a more aggressive target, for example, or it could be by sectors of the market, hospitals or health plans or medical groups. So that's really foundational work. I'm also really excited about our efforts to improve our healthcare system with the APMs and the primary care spend. Again, I think it makes intuitive sense to people. If you invest in primary care and preventive care, we're going to increase outcomes. But what I really most hope for and what animates my work is making a difference for consumers, for families struggling to make ends meet, for seniors who go without needed medications because of the cost. So that's why we're here doing this work, is because we've heard so many of those stories. And because our healthcare board, our affordability board is a public meeting, we've had, at every meeting, we've had consumers come tell their stories. We've had, folks who work in hotels, cleaning hotels, who have thousands of dollars in hospital bills, even though they had insurance. At our latest meeting, we heard from a mother in her 40s who was diagnosed with MS. So she went from a healthy person to one needing a wheelchair, a power wheelchair. And, she was crying as she spoke to us about the cost and the impact it was having on her and her family. And so, those are the stories of that really motivate our work. And so we the spending growth targets are not a perfect solution. None of this is. It took us decades to get to the healthcare system where we are. We're not going to be able to turn this around overnight, but we do know that something has to change, and we do believe that the strategies that the office has are the right place to start. So we're here because of those consumers and their challenges. So what most excites me is trying to make a difference for them.
That's great. I have a mom who's a senior and retired, and she'll love to hear a lot of what you just said, because care is definitely expensive for her. Well, Elizabeth, you've been a wealth of information. So again, folks, check out the website, HCAI. I learned that's the correct pronunciation, hcai.ca.gov. Elizabeth also shared about a ton of data and visualizations at the conference back in October. There were a lot of great graphs. So keep an eye on the website for different reports in the future that she mentioned. Elizabeth, really appreciate you taking the time today.
Thank you so much. Great to be here.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.